Why do children have normal exams?
So a lot of times when children disclose about abuse, the abuse didn't just happen. There often is a delay in disclosure. It could be weeks, months, years before they realize like it's safe to tell, or they didn't realize initially that that was wrong. I mean, that's sort of what they grew into, and then finally they go to school and they learn that that shouldn't have happened, and so they share. So that delay, often can allow, the body is really good at healing. So even if there were small signs of trauma, it can heal very quickly. And a lot of times for young children, the type of abuse often doesn't leave actual evidence. So it's not like on a lot of the TV shows where they go in, they collect that DNA, they match it up, and it's really easy. But a lot of times, children may be touched. There's a lot of pornography being shown, especially with internet access is so prevalent, and that can be a good reason that, even if we saw them right then and there, oral sex, things like that. And then it's really important when we start learning, especially young children's terminology, when they say, something bad has happened, or there is sort of this thought process that there was some kind of genital penetration. It's not like an adult sort of act, it's different, and so that might not leave evidence on exam. And then once you become a teenager, again, your body, because of all those hormones, allows things to really not cause actual trauma sometimes. So even they too can have normal exams, even if they're sexually active by choice, or sometimes with abuse as well. So the exam is extremely important for lots of reasons, but as far as it being kind of the like yes or no, the kind of litmus test, it is not. And I can remember when I first started doing this a very long time ago now, there was a concern about abuse. The police would take the child to the doctor. If I would say no, there's no signs, they would say, well, there's nothing we can do. So we have come a very long way, thankfully, in realizing, what the medical role is. Important, yes, but certainly not that sort of end test to decide if there is abuse or not.
So what does happen now with the police if you say
So the police now know that, if a child is having certainly any kind of medical issues, they do need to either, like if they're bleeding or discharge or it just happened, they need to have that forensic exam done to collect that kit that's done. If they're having actual symptoms, it needs to be addressed immediately. But like I said, a lot of times children aren't disclosing right away. So that most important part is what a child is saying. That's important. And then the behaviors that we see in young children. So, we'll see, 3 and 4-year-olds sexually acting out on other young children. That's just not normal child behavior. And so that often is a pretty telltale sign to say, something's going on and we need to try to understand it. And the Advocacy Center is set up with interviewers that are very comfortable in dealing with young children and know how to ask them questions or listen to what they have to say, and not kind of lead them down a path, but try to understand what their experience is and what that means.
So we use the mock house as a way to simulate what it looks like and what it feels like to live in an abusive situation. This is a very extreme setting. We also teach child abuse can occur in very pristine settings with little evidence around you, but because we teach a trauma framework that is embedded in adverse childhood experiences, we like to simulate that in this house. So if you look around the house, and we really don't invite people in until they understand why we're using this space, you'll see evidence of every adverse childhood experiences in this home. That's intentional. It's intentional for several reasons. We want to bring that awareness so that we can promote more sensitivity and more thought to how we can change our responses. But we also want to make sure those who report and investigate child abuse don't miss any signs. Often a single incidence of child abuse would be reported and investigated, and there may be 6 or 7 other charges that could be brought forward and prosecuted. So a lot of child abuse cases, in fact, all of them are very messy because children are your victims and your witnesses. Their stories don't always make sense. Their vocabularies aren't always accurate in what they're trying to tell individuals. So we really want to train the professionals to understand that and not just go after one type of child abuse, but to look for poly-victimization and prosecute it thoroughly.
Okay. You also have a mock courtroom. What kind of training goes on there?
So our mock courtroom, we actually have a meeting in there right now. It's a multi-purpose room. It's designed to look like a courtroom. We use the Spartanburg County courtroom to model our courtroom, and the solicitor says ours actually looks better than his. But we do trainings. We do how to prepare to give testimony. So if you're going to go into a courtroom, especially if you're a child, you're going to find that environment frightening, intimidating, and difficult to to be able to give the responses you need. So you can come into our courtroom and you can prepare, which will help give more effective testimony. And it's just a great training room too to set the stage for what we are teaching in our training center.